Okay, we just recorded a fantastic podcast with Dr. Andrea Herschorn, Cosmetic Doctor.
Thank you. That was really fun.
We covered all the things. We covered injectables, laser treatments, what they do, how you can treat different patients, why some patients go overboard, and how you like to keep it au naturel. All right, guys. Well, take a listen to the podcast, and we hope you learn a little something. All right. Welcome to the podcast, Dr. Andrea Herschorn, Cosmetic Doctor.
Thank you so much. I'm so happy to be here.
We're happy to have you. It's actually so funny. I was thinking, like, when we originally posted to our followers on Instagram, who do you want to see on our podcast? Who do you want to hear from? You were one of the top ones.
Oh, yay. Thank you.
Yeah. I think a lot of people really want to know all about cosmetic procedures and, you know, just sort of talk about myths and, you know, different things that I do, that you offer, questions that your patients ask. So I'm really excited to just kind of cover it all.
I'm so excited to be here. This is great.
So why don't we start off and maybe just talk about kind of like some of the biggest misconceptions around, do you want to say Botox filler? Like, are those still the biggest treatments that you do right now?
Yes, they are. So I would say that let's talk about them in two different categories. Let's start with Botox because they're such different procedures.
Yep.
So let me tell you a little bit more about what Botox actually is and what it does.
Okay.
Because there's some patients who aren't really sure.
Yeah.
The first time they come in, they know they want something, but they don't know what. So first, let's just say Botox is a treatment that relaxes muscles so that you're not able to make the movements to the same extent. For example, in your frown, your upper forehead, and your crow's feet. And what happens is the wrinkles in those areas diminish.
Okay.
So what patients are concerned about is, one, am I starting too early? Am I not going to be responsive to the treatments as time goes on? Am I going to look overdone if I start too early? Is this preventive? Will it help me? Am I damaging my skin, my muscles, etc.?
Well, you literally just asked all the questions that I feel like I have been asked about the treatments.
Yeah. And those are all understandable questions and concerns, right? So what I find is, as long as you're starting at the time when you are forming wrinkles when you move, if you have no wrinkles at all when you move your face, I'd say you can do it preventively, but very small dosing just to make sure the creases don't form.
Okay.
However, it's going to be most effective if you have even some creases when you move.
Okay. So time to start is maybe obviously so person specific.
Definitely.
But when you start forming wrinkles, if they are bothering you, then it would be a good time to go and get a consult.
Exactly.
Okay.
And the dosing that we can use, it's funny. Some people say, I want baby Botox. I want baby Botox. So what that means is they want a light dosing. But I also need to counsel my patients that baby Botox basically is, if you have really deep wrinkles already when you're 25, a little tiny bit of Botox is not going to be enough for you to prevent the creases from getting worse.
Right.
So it really has to be individualized. So I can keep the dosing light. So when you go with a lighter dosing, that means you'll have more movement.
Okay.
But more movement means the creases may still continue to form.
Right.
So it really has to be, as I said, individualized to the patient and what their goals are.
Want.
Yeah.
So preventative is a thing, because that's actually, and maybe I should kind of like go back and start from the beginning, which was when I started seeing you. And I was actually thinking about that. So it was probably in my late 20s, maybe mid to late 20s. I can't remember exactly when. And I had one of those like 11 lines, which my mom has, and it bothered me forever. Like I swear it started when I was like 17. And so I had come in for that. Ali Bud actually referred me to you.
I love it.
And that was sort of where I started. And it was with light Botox and preventative. And now 10 years later, I think if I hadn't done that, it would be so much more deep-seated and so much harder to treat, like you said. So in terms of prevention for wrinkles later in life, that is a thing. That is accurate.
It is accurate.
And when people start later and wait longer, it is harder to treat those wrinkles.
That is true. If the wrinkles are etched into your skin, we may not be able to erase them.
Okay.
So if somebody comes in at the age of, let's say 40, which is an okay time to start Botox, there's nothing wrong with waiting until you're 40.
Right.
However, if they already had creases starting in their mid 20s,
it's going to be harder to treat.
Hard to get rid of them.
Okay.
And so I say, we can try to improve them, but they won't be gone, even with a really
Like
not
a lot
aggressive treatment, but it's something that's going to stop your movement completely.
Okay.
They will be minimized. And the goal and the hope is that the longer we have your relaxed movement, like the longer we have your movements decreased.
Right. Over time,
the creases will improve in the skin, but they may not go away completely.
Okay. And do you find sort of like an average age for when women start to come to, or men, I guess, is in their late 20s?
So I find a lot of patients now in the past several years, things have changed. So the demographic has gotten younger. However, I find a lot of patients who come to me are in their early 30s or late 20s.
Okay.
Some of them, like for, let's say, women, they've had a baby or two and they notice, oh my gosh, I look so much older than I did before my babies. What's happening? I look so tired and I don't like
age
this.
you exponentially.
Oh yes, they definitely do.
I feel like COVID made me look 10 years older.
And that
what
too,
has happened?
COVID also. COVID and babies.
Yeah.
So I'd say late 20s, early 30s is very common for me to have, like for the age, for a female to come in to see me.
Okay.
Men, it just varies, like 20s, 30s, 40s. Sometimes they're the partner of one of my patients. Sometimes they come on their own. Sometimes they come first and then they send their male or female partner.
Right, guy, what do you think? Is this for you? Pick up that mic. Let us know. Have you considered Botox?
I have not considered Botox. I'm more worried about my hairline, to be honest with you.
Okay.
That's what I'm most
That's the primary concern.
Yes,
yeah,
absolutely.
your skin's still fairly smooth.
Yeah, I'm not too worried yet.
And it's interesting. There's definitely a double standard for men and women.
Right.
Not all men feel that same way, but most men are okay to have wrinkles. They are happy to have wrinkles and they look distinguished and they look attractive with wrinkles. Whereas women, depends on the woman. Some women want wrinkles or are okay with some and others don't want any. But more often, it's not as acceptable for women to look like they're getting older. Whereas men, it's actually desirable.
Right.
And it's not really fair that women have to go through that. And I have this conversation with a lot of patients. It's like, I want to help them feel good and feel better about how they look when they look at themselves in the mirror, but keeping in mind, you want to look natural. And it's like, what's this balance? How do you look natural, but still have movement?
Right.
But also improve your creases and then or minimize the aging process as we get older, but without looking overdone.
Right.
So it's like,
it's so many things. Well, and I feel like truthfully, going back to kind of like how your business has evolved over the last 10, 12, 15 years, social media, I'm sure, is such a big part of that. And I mean, I don't want to speak for everyone, but I feel like Lanny and I have been so honest with what we've done over the years. And it's something we've like not ever really hidden. And I'm happy to big you up. And I do think it was one of those more taboo subjects years ago where it was like, oh, I'm just, using olive oil on my skin, J-Lo, that's why I look so good. And now I do feel like there are more people who have platforms that are sharing what they're doing.
Right.
Do you think, content creators, influencers have that responsibility to say, I am getting this done. It's not just a cream. I'm doing this because I want to, and it makes me happy. Or that they don't have to talk about it.
Well, I think that what you're doing is amazing and it's perfect. And I'm the same, right? Of course, I'm going to be honest about what I do, what I don't do. And I think what it does is it normalizes for people that it's okay to have treatments done if that's what you want for yourself.
Right.
And it doesn't make others feel badly because they don't look like that naturally.
Right. With just some oil of Olay.
Yeah.
Yeah.
So I think it's important to be honest about it. I love that you are.
Yeah.
Because your followers and everybody needs to hear the truth. I believe in the truth.
Yeah.
So,
well, I've had 4 kids and I have no wrinkles. So that is certainly not natural. To be honest, the only person who I really try to block is my husband. I honestly, and I don't know if you feel like this, but husbands, his mom is so natural. My mom is so natural. And I think for a lot of men or partners, they feel like it's such a slippery slope. Even when I introduced you to Benji this morning, I'm like, I literally got a rash. I'm like, I have no problem talking about Botox, fillers, literally all the things I do to our, followers. But I was like, as soon as my husband walks in the room, it's like, oh God, I just got, a light little peel or a laser. I'm like, I don't like telling him I've gotten Botox because his biggest thing is like, once you go there, you're going to look like Catwoman.
Right. So there's a few things I just thought of I wanted to say. So one is, I definitely have probably half of my patients hide their treatments from their partners.
Ooh, what do you think about that?
I would feel like it's probably half.
Yeah. Because of that same feeling where it's like they're going to start and they're going to look like,
and I understand. I understand the worry. So their partner may say, okay, their partner probably just notices all the obvious filler work, for example, and they're worried that their partner's going to look like that.
Yeah.
But it doesn't have to be the case. So it's always so funny that my patients say, oh, my partner didn't even notice I did this, but I'm so happy with my results.
Right. And that's the goal for you, which is why I've always loved you and why you're my OG because it is so natural and people don't notice, AKA my husband.
Right.
He'll be like, you look good today.
Perfect.
Right.
You look
like just a better version of yourself versus like, ooh, those lips are a little too big.
Yeah. It's about looking like the best version of you without looking like someone else, or maybe looking the way you did a few years ago is the goal.
Right.
And so, with respect to filler, so there's concerns. Often patients are really nervous about doing filler for their first time.
Because Botox is, like you said, relaxing of the wrinkles. And I actually like how you said it, which is relaxing versus freezing. And I think the misconception around Botox too, however many years ago, was like, you're freezing your face. You're not going to be able to move. And I think with what you try to achieve, and I feel like probably so many cosmetic doctors now, is movement, like slight, subtle movement.
Exactly.
Right?
Enough movement that you still have natural expression.
Right.
But minimize the creases as much as we can so that within the 3 to 4 months when the Botox or Dysport is working, there's going to be improvement in the creases.
Right.
So there's also the preventive aspect.
Right. But you can still
longevity.
Laugh. You can still laugh when your kids crack a joke.
Exactly.
Right.
And your kids will know that you're happy.
Right. You're like, Mom, are you sad
okay?
today? What's wrong with you? That is not the goal.
Are you angry with me?
Right. Yeah, the angry eyebrows is a thing. Okay, so biggest misconception is around filler and am I going to look plumped up?
Yes.
Right.
Yes. So am I going to look overdone? Am I going to look like Catwoman?
Yeah.
Will it be obvious? And the fear of there's been a lot of talk on social media about filler building up over time, making you look saggier as you get older, or, just causing deformities and issues. And migration is a big concern for patients too.
Right.
Does it migrate from where you've placed it? So I've been doing this cosmetic work for 11 years now. And I can tell you, it is actually very uncommon for me to see any migration happen. And it's all fixable.
Right.
Filler is dissolvable.
Right.
So if there is ever an issue, we dissolve it.
Right.
And it is extremely rare for me to see any complications. Like maybe 1 a year at most.
Right.
Which is very reassuring to me.
Right.
And I can feel confident and comfortable recommending filler to my patients. I also have filler in my face.
So where do you put filler?
Nasolabial folds.
Okay. I feel like that's a big concern as you get older.
Yes.
Right.
And so there has been talk on social media about filler migrating from the nasolabial folds. I don't think I've ever seen it.
Right.
Maybe I had a patient who had treatment from someone else.
Yeah.
Who came to me and asked me about it. I'm talking one patient.
Right. It's a risk. There's
really
always risks associated when you're getting it done.
Exactly. And I review them very thoroughly.
Right.
But most patients are just very happy with the results and they can look natural. So that is the number one thing.
Okay.
Filler can be done subtly.
Yeah.
Naturally looking.
Yeah. Well, I've had it too. And I love it.
Exactly.
Yeah. And you actually, and I feel like maybe we'll talk a bit about this because I think you probably get a lot of questions around it, is the tear trough filler.
Sure.
Ryan, do you know what that is? Tear trough filler?
No, I have no idea.
Little pop quiz for you this
I am
morning.
getting a lot of education from Sarah, but I do not
You're
know
unclear.
what that is. Yes.
So it's kind of like hollowness under your eyes.
Mm-hmm.
So maybe you can just talk a bit about this treatment and who's a candidate and if it is a big procedure for you.
Oh yeah. It's probably one of the most sought after filler treatments that comes through my door. So I'll tell you about the under eye filler treatment. So I will only treat somebody if there is enough volume loss or enough space in the under eyes to be able to accommodate the filler.
Okay. And you can tell that just by feeling.
And by looking. I will then, every under eye is different. Some people have a bit of a bag, so they have puffiness. Some people have just the hollowness. Some people it's more complicated because they have the hollowness and the puffiness. Sometimes the hollowness is not only in the mid part, but it's also on this side, like the lateral orbital area. And so what I do is I tailor the treatment to specifically what I'm seeing,
Right.
what I'm feeling. And then I will also tell you, do I think you're going to have a good result, an amazing result, or do I think you're going to get some improvement, but it's not going to be drastic and dramatic?
Right.
And then the patient will decide if it's something they want to go ahead with or not.
Right. So every single case is different depending on your texture. And is that just genetics, really?
Genetics, and your aging process.
Right.
And also if you've had filler before,
Right.
if you've had surgery before,
Right.
there's so many different factors. Yeah.
Okay. And if you are getting it done, it typically lasts about a year. Like how long does
Yeah.
filler
So
actually stay?
That's a good question. Okay. So with respect to the under eyes, there's a few different products that I will use. One that's more light for someone who doesn't have a lot of space there.
Okay.
And one that's a little bit thicker so that to accommodate for somebody who has more hollowness. The lighter product, I just find it doesn't last as long.
Right.
I mean, it makes sense, right? Like if it's lighter, there's less cross-linking. It's not going to last you 18 months.
Right.
Whereas the thicker one and when I say thick, it's still not thick because it has to be used for the under eyes.
Yeah.
But it may last 12 to 18 months, but it really depends on the person.
Right.
And some people, I'm just blown away by how long it lasts for them.
Right.
So 6 to 18 months, really.
Yeah.
Some people at 6 months will need a little touch up, and that's fine.
Everyone's different with
Everyone's different.
how their body absorbs it. Okay. So why don't we talk about a patient comes to you and says, I want a little plumping on the lips.
Yes.
What's the first step?
Okay, so I will assess their lips, how thin they are, if there's a lot of wrinkling, the hydration level, and what it is that they want to achieve.
Right.
So there's some patients who say, I've always wanted just a little bit more on my lips, or I want more volumized lips, especially if they have features that can accommodate a bit more of a volumized looking lip, but still a natural look.
Right.
And so a lot of patients who will come in, they'll say, this is interesting. They'll come in for other reasons.
Right.
And then when we're about to start soon, they're like, okay, I think I want some of my lips.
Right.
And I'm like, okay, let's talk about it.
Right.
It's like, because they want that little bit of a plump,
Yeah.
but they're so nervous, understandably,
Yeah.
about looking overdone, because that is what shows,
That's what
the most
shows. It's not
obvious.
Botox. It's not a little nasolabial filler. It's the lips.
Exactly.
Right.
Yeah. It's the lips. So we certainly can put just a little bit in the lips.
So you evaluate, you make a
Evaluate the
decision
lips.
based on their features, and then you start. Well, I know with me, again, I haven't had this done in years, but you were like, let's just do a little bit here, a little bit there.
Mhm. Yes.
And then there's swelling, and then you see once it goes
Exactly.
down how it looks.
You got it.
Yeah.
So there's a few things. One is, yes, swelling will happen.
Yeah.
So when we put topical numbing cream on, that causes swelling.
Yeah.
The injections themselves cause swelling.
Right.
So when you look in the mirror right after, first of all, the feeling of numbing makes you feel like, oh my gosh, my lips are so big, even if we didn't even touch them yet.
Yeah. You're like trying to drink water. It literally just
It's like if you go to the
dribbles
dentist
down your face.
and you look in the mirror, you're like, oh my gosh, my lips look so big.
Yeah.
Like if you had numbing at the dentist. But I always have to reassure, don't worry, they will come down. So they come
Right.
down, but they're like, but I want them to stay like this.
Right.
Then they come down in size, and some people will have more swelling over the next few days. So we've had patients who call and they're freaking out. We have to dissolve. We have to dissolve. And my wonderful assistant, Simon, will talk them off the ledge and say, we
Just
will
wait.
dissolve,
Yeah.
but we just have to wait.
Yeah.
Just wait it out. And then we
Right.
get a call the next day. Okay, you're right. They're amazing. And
Right.
this happens.
Right.
So
So maybe
swelling
if you're
can
getting
happen.
lip filler, don't go to a gala that night. Just at home.
Plan it accordingly.
home
There could
and
be
lay
bruising,
low.
There could be swelling.
Yeah.
Just plan it accordingly for your life, whatever is happening.
Yeah. Avoid your partner and tell them you'll see him in the morning.
Exactly.
Yeah.
And so as long as we are caught, as long as we pick a product that is appropriate for your lips,
Right.
and then as long as the way I treat lips is not to project them forward.
Right.
The key,
Okay. So actually, I have a question about this.
Sure.
What is a lip flip?
Oh, great question.
What is a lip flip?
Great
I've had a
question.
couple friends that are just like, yeah, I just had a little lip flip. And I'm like, well, what is the difference between that and just getting filler? And who do you recommend that for? Because I actually think then I came to you and I was like, well, I need a lip flip. And you were like, no, you don't.
Yeah, I'm like, your lips look amazing already.
Yeah.
We don't need, but we could, it's okay. A lip flip is injecting Botox or Dysport above the lip
Okay.
to basically turn it out a little bit, lift it up, like lift the peak slightly. So there's
Okay.
two different ways to
You're getting me a
approach
little
it.
little duck lip.
So it actually doesn't look ducky when you
Okay.
do it, but you have to make sure that if someone has very volumized lips to start, I mean, it is a subtle change.
Right.
Okay. It also depends how much Dysport or Botox you're using.
Right.
So above the peak will lift lift the peak in the center.
Okay.
And there's also putting along the sides of the body of the lip. So like just above the sides.
Okay. So it's mainly for the top lip, not the bottom.
Yes, correct.
Okay.
So the lower lip you can also put, but it's less common that we do it.
Right.
Sometimes it's for the wrinkles. So the way that the side part works is it decreases your ability to purse your lips.
Okay.
So it's a combination of one, trying to prevent creases from forming by not pursing as often or as straight or as strongly, but it also turns the lip out slightly. So some patients are good candidates if they find that when they smile, their lip disappears a bit.
Okay.
So it's a really good place to start for them to try out what they think of it. It doesn't last that long though.
Okay.
Because it's
What's not last long, like a couple
maybe
months.
a month, maybe 2 months at most.
Whereas if you're getting lip filler, I feel like that can last for years.
Exactly.
Yeah.
And so I find that it's a really good place a good way to ease in if they're like, okay, I want to see what I look like if I have a little bit more volume appearance to my lip, but it doesn't last that long. So if I don't like it, it'll go away.
Right.
And so it's a way to test it, whether or not they may want to go ahead with lip filler.
Okay.
That's how I think of it.
Okay.
Because it doesn't last so long, but it also does change your movements a bit.
Right.
So if you can't purse your lips to the same extent, and it feels a bit weird and numb for a few weeks.
Do you have an issue smiling?
Not smiling.
Okay.
It's the pursing, it's sipping hot coffee, drinking from a straw. It's like you feel a little restricted doing like, some people love it. They're like, I don't care. I want it anyway.
With other mouth movements.
Exactly.
Okay. Other things you're putting in your mouth.
Yes,
All right.
Yes.
Okay. So I kind of want to switch off maybe from the injectables to talking about some of the treatments you do, like Morpheus, like Forma, like Lumecca. There's so much out there. I personally, I want to try Morpheus in the new year because I've heard so many good things about it. Maybe you can kind of talk us through that specific treatment.
Sure.
I actually, not just my face, because I've got scarring from when I was younger on my cheeks. So I wanted to help with that. But also my neck, my décolleté is looking very wrinkly lately.
Yes.
And then I'd also talk to you about Morpheus for my stomach, for tightening the skin around there. So maybe you can talk to us a bit about the treatment, how people are using it, and the results. I know there is a bit of downtime. People say it is painful AF. So let us let us know.
Very good questions. Okay, so Morpheus 8 is basically it's micro needling,
which I've had,
which you've had. That's for sure.
Yeah.
With radio frequency. So radio frequency is an energy that's delivered underneath the skin at the depth of where the needles are going. And the depths are depending on what part of the body we're using, what we're trying to achieve. It delivers that energy. So we stimulate collagen. Collagen stimulation results in improvement of skin texture, skin firming. Also does help a bit with pigment concerns. And then the scarring.
Right.
That's it's really good for scarring.
Right.
So it's improving your skin texture, collagen stimulation, elastin, and firming and tightening your skin.
So it basically does everything.
It does.
Okay.
And we always will put numbing on your skin in that area for half hour, 45 minutes, an hour, depending.
Right.
And then it makes it much more tolerable and comfortable. Truthfully, it is not the most painful treatment out there at all.
Okay.
There were way worse and there still are.
Right.
So it's actually tolerable.
Okay.
Considering how effective it is.
Right.
With respect to downtime. So basically what happens is you're going to be red right afterward.
Right. Like a sunburn, which is what kind of like PRP does with the needles. Yeah.
Even microneedling alone, if you ever had that done, that causes the same result pretty much. Like not the same result, the same pain or the same after look.
Okay.
You're red afterward.
Right.
But generally within the next 12 hours, we find patients' redness comes down tremendously.
Yeah.
If there's a bit of swelling, that's usually come down. Usually by 24 hours.
You're good.
You're pretty good.
Okay.
Which is every time we, my amazing esthetician, and love her, she shows me the pictures of all the patients who are like, okay, they had 24 hours later. I was like, oh, that person looks amazing. She's so glowy and she's a little bit pink, if that.
And do you see results right away? Or is this the kind of thing you need 4 or 5 treatments and then it's like 6 months later, you see results?
Good question. So you do get an instant tightening result just from the controlled trauma to the skin within the first week or so.
Okay.
That's the way radio frequency and microneedling will work. Is just it'll give you a little bit of a tightening initially, but for the prolonged and gradual increase in collagen stimulation, that takes more time. So basically we recommend Morpheus 8 treatment every 6 weeks for 3 sessions.
Okay.
And by 6 to 12 months later is when you're getting your full effect.
Right.
We've had lots of patients come back and say, people are just saying my skin looks amazing. They don't know why. They just say I look great.
Right.
And it's like, amazing. That's
So
what we
you're still
want.
seeing stuff in between, but you've got to be patient with this.
You do.
Yeah.
So it's not a quick fix. So
Right.
the thing with any technology, yeah, you can see an initial result, like an initial tightening,
Right.
but for the prolonged result, you have to wait it out a bit and have the right number of treatments. And it's generally 3
Okay.
to start.
And you can get your Botox, your filler,
Yes.
whatever you're doing, you can still do in between.
Yes, you can, as long
Right.
as you space it out enough.
Okay.
That your skin has healed between the treatments.
Okay.
And we can recommend how to space them out for you.
And what do you think about doing Morpheus on your, like, what is,
Yeah.
maybe I'll just ask, what is the best non-invasive treatment for wrinkles on your neck and also for stomach tightening?
Yes, I would say as long as we have to go with a much lower, shallower depth when you're doing anywhere in the chest, of
Right.
course, because the skin is
It's
very
so thin.
But same with the neck.
Right.
Yeah, so we can address the neck, décolleté, and abdomen. So the belly is a big one we've been getting a lot of questions about.
And have you done,
We
you've done this on patients?
have, and they
Okay.
find they have tightening. It's
Okay.
great. The thing is with any technology, I don't say, oh yeah, come in, it's gonna
We'll
be
fix
perfect.
everything.
It
Yeah.
just doesn't work that way in reality.
Right. And like you said, everyone's skin is
Everyone's
so
skin's
different.
different.
Yeah.
It's the same with so I know Botox and fillers, I know I can pretty much guarantee the result. Like it's rare for there to be someone to not respond the way I expect.
Right.
It happens, but there's very few of those.
Right.
I find technology is that's just the nature of it. It's going to be, you have to really commit to it. It takes longer to see results, but that is how it works when you're trying to do an overall tightening improvement, as opposed to like I'm going to fill this fold for you. That's just the way technology is.
Right. And so now for the stomach, when people
Yes.
come to you, this is after children or
Often,
weight
yeah.
loss or
Yeah.
right. And in terms of the efficacy,
Efficacy. Yes. I knew what you meant.
Efficacy?
It's all good.
I know I sometimes mispronounce words. Do you see like a 90% improvement? And again,
It'll
I know
depend
you
on the
can't
person.
say, but like,
It'll depend on the person, how much laxity of this they have in their skin. If
Right.
it's just like they want a bit of textural improvement and some tightening, yes, it's going to work.
Yeah.
But if they need surgery, they need surgery.
right.
So it just will depend.
It's a case by case basis.
And the thing is that as long as we are counseling patients and saying, we're going to get improvement for you,
right.
it's not going to be flawless.
Yeah.
Because that's not reality.
But we can make it better.
We can make it better.
Yeah.
And it can also be used for the bum, like the banana roll area, like on the back of the thighs, to tighten the skin.
Okay.
It works really well.
Okay. And you would say Morpheus is the best treatment for tightening, texture.
Exactly.
And do you find women now kind of like in their late 30s is where they're starting with Morpheus?
It really depends. So that's a very good question. So you could even start in your 20s if you wanted to.
right.
There's different tips for Morpheus.
Okay.
So if you just want to improve your pores,
Yeah.
we have a tip that only goes a certain depth.
Right.
And so that will help with the texture only. But, it depends also. Energy levels can be changed up depending on how much aging you have to fix up.
Right.
Right. So someone younger, we go with a lower energy. Maybe you don't do as many passes over the skin.
Right.
Or you just use the tip that goes a little bit more shallow.
You tailor it depending on the age and what the
Exactly.
needs are. And then tell me, does that kind of thing, like a Morpheus, does it thin out your skin over time? Like all these treatments, like, I mean, I feel like I've done so much from like peels to PRP, whatever it is,
Yeah.
like over time, or is it just your skin is thinning over time and that's just what it happens?
It actually is helping with the thinning because
Right.
it's stimulating collagen and elastin. So it's
Okay.
going to be thickening your skin.
Okay. So
Yes.
don't look at the treatments like, oh my gosh, I've done so much. It's actually
No.
like
Not at all.
making my skin thinner.
No, not
Okay.
at all. Not
Okay.
with any of the ones at least that I offer. I can confidently say that that's not going to be the case.
Okay. Okay.
Yeah.
And then in terms of, I know you also have Lumecca and Forma. Maybe you can talk to us a bit about those treatments and
Yes.
the difference in concerns when people are coming to you and you say, okay, you know what, this is your concern. I actually recommend Forma, or I recommend Lumecca, or maybe I recommend, a series of chemical peels and some Botox, because there are
Exactly.
so many options.
Definitely. There was one thing I wanted to mention also about the Morpheus before we move away from there. We do have the option of treating around the eyes specifically too. So as long as we
Oh.
there's a specific tip called the eye tip
Right.
that you can use safely around the eye to help tighten. And it's a really nice way to tighten the skin and thicken it in conjunction, obviously, with improving the wrinkles with Botox or Dysport.
Okay.
So we have a package that includes around the eyes, but also we can work around the mouth, the lip lines,
all those other areas that people are concerned about.
So if we're trying to really just target certain areas and if somebody doesn't want their full face, neck, and jawline
that's
treated,
also possible.
it's also possible. Yeah.
Okay.
Okay. So if somebody comes in and says, all right, they're in their 30s and they want some skin tightening, but they're not saggy and they just want to prevent, Forma is wonderful.
Okay.
Okay. Forma, I absolutely love it.
Okay.
It is one of the most relaxing treatments you can have.
I just saw you getting it. You're like, it was like a hot stone massage on your face.
I want to sleep thinking about it.
Okay.
It's that relaxing. Exactly.
So that's like just gives a little, and you find people do it a lot under their chin, like to help with the double.
It does help a little bit with that. Honestly, double chins are a tough one to treat. So we really have to tailor a treatment to you depending on how intense it is.
Okay.
But the Forma is wonderful because it does face tightening or neck tightening.
Okay.
I mean, it can be used in other areas of the body as well. It's a radio frequency. So basically Forma is a radio frequency energy, just like the Morpheus.
Right.
But you don't penetrate the skin at all.
So it doesn't have the needles.
Correct.
Okay.
So it's relaxing.
Right.
It's like a wand of warm heat that you can fall asleep 5 times in your treatment.
Okay.
And it's giving you an instant tightening.
Okay.
So it's actually called the Hollywood facial because you can have it done right before an event and you just look glowy and tighter.
See instant results.
Instant results.
Okay.
If you want to maintain results like anything, you have to do a series of treatments to actually stimulate collagen that stays.
Okay.
So typically we recommend on the low end 3 sessions.
Okay.
Ideally it's three weeks in a row.
Okay.
That's somebody who really doesn't have any sagging at all and they just want to prevent.
Okay.
If somebody has some signs of sagging already or, loosening the skin or like they need some more tightening, we recommend 6 sessions once a week for 6 weeks. Not everybody can do that in their lives. Not everyone can accommodate that in their schedules. So if you have to extend your treatments, every 2 weeks or whatever it is, you're just maybe not going to get as quick at results, but you're going to still get your results.
You'll still see the tightening. Okay.
But Forma is relaxing. So it's not as invasive as the Morpheus 8. So if you're looking for dramatic results with Forma, you're not going to get that.
Yeah.
It's a lighter
But you'll still see a glowy tightening.
Exactly.
Okay. So that might be a good place to start if you've got good skin and you're just looking for a little zhuzh.
Yes.
Okay.
And also someone who's done their 3 Morpheus sessions wants to maintain their results. They go with Forma once a month, twice a month. We have patients who are there once a week for their Forma and they're like, they just don't want to leave. They want to be there every week because it's the best
treatment. Okay. Okay.
So, it's just because it's so relaxing.
Right.
And then we also have, the Lumecca, which is an IPL.
Okay.
Okay. So Forma and Morpheus 8 treat skin texture or Morpheus specifically tightening, collagen stimulation. IPL, Lumecca, is a laser treatment that's specifically for complexion, redness, sunspots, dark spots.
Okay.
It also has a little bit of a light collagen stimulation too. So like traditional, you can think of it as like a photofacial.
Yeah.
But typically we're using it for more pigment improvement.
Okay. So would you combine, like, I'm again thinking of my chest, like, would you combine a Lumecca and a Forma together?
Yes, but we wouldn't do it the same day. We'd be spacing it out. We'd probably finish one package first just to give you like the full result of one and then move to the other. It just depends. If some patients want to tandem it, that's fine.
Right.
But you're having to separate your treatments every 2 weeks or so. And so with the IPL, usually and also for rosacea. So it's for redness, for someone who just has flushing redness and you want to improve it. Same with any other technology. You have to maintain, you have to do the right number of treatments to get the results you want.
Right.
We recommend starting with 3 sessions, but usually most patients will need 5 IPLs. It's definitely one of the strongest IPLs out there.
Right.
But the reality of it is you need the right number of treatments to achieve what you want.
Right.
So IPL is it's amazing for pigments. So combining that with chemical peels is fantastic.
Like a glycolic peel.
Yes. So we have different chemical peels just depending on what we're trying to achieve. Like if we want, and if somebody has never had one, we want to start with a light one.
Yeah.
Unless they're like, go ahead with it. We want something stronger.
Well, and again, I feel like I was seeing this on your Instagram, which I think is totally true, is there's such a misconception. Like I remember chemical peels 10 years ago, you would go and come out looking like Freddy Krueger And that was just the norm. Whereas now it's like, no,
Not at
chemical
all.
peels don't have to be harsh and terrifying and like strip your skin of all the
Exactly.
things. There, like you said, there's lots of different options.
Right. And I like to think of it as like a light exfoliation.
Right.
If that's how you want to start, 3 to 5 days later, your skin will flake a little bit.
Right.
And we give you products to help calm that down.
Right.
Like it's really not scary. It sounds scary.
Well, I'm literally
But it's
picturing
not.
like Samantha from
I know,
Sex
that's
and
what
the
I was
City
thinking
when she
too.
was like wearing that like giant hat and she's like, I just got a peel. But obviously it's come a long way.
Yeah.
And like you said, so
Yeah,
I
it's
think the
all
main
tailored.
takeaway is there's so many different options wherever you're going is kind of like share your concerns and have your doctor put together kind of like a whole holistic plan versus just saying, I'm just doing this or you can't just do
Right.
that, but at least maybe look at big picture and say, this is also, in 5 years, maybe what I might be concerned about. And, versus also just kind of like doing in the moment what works.
It's so true.
Yeah.
And we also have fantastic facials.
Right. Okay.
that
So
are-
maybe let's talk about that because obviously
Yeah.
there's injectables, there's lasers, there's lots of things you can do. But if you're starting young or you don't even want to go there yet from a skincare perspective,
Yep.
I know obviously you love Biologique Recherche, but is it just kind of like, are there certain medical grade products? Is there something everyone should be using like a vitamin C, a hyaluronic, a retinol? Like where can people kind of start in their routine versus
Right.
just coming to you with, all these concerns, right?
Yes. So I would say that depending on the age,
Right.
you're going to have different needs.
Yeah.
Yes, a retinol is always a great thing to have in your regimen. That depending, and if you have pigment issues, you're going to probably want to use a hydroquinone as well. So that's another lightening cream. A vitamin C is great to help protect from sun exposure, from the elements, from free radical formation. Hyaluronic acid is really hydrating. Of course, that's also what filler is made of. So
Right.
that's, it gives people a reassurance that, okay, filler is not scary if I use it in my skincare. That's always nice for people to think about.
Right.
But really it's about hydration
Right.
and not aggressively washing your face all the time. Just keeping it just to the products that you need to keep hydrated.
Right.
But number one is sunscreen.
Right. I knew
So-
it, Mom. My mom always
Yeah.
wear your sunscreen,
Sunscreen. I am
even on a
totally
cloudy day.
diligent. Exactly. If you're near windows,
Oh God.
UV's coming through. So we just always have to be wearing sunscreen.
In your
even on
car.
in your car, especially.
Okay. So
Yeah.
sunscreen is
Sunscreen.
number one.
Sunscreen.
You know what? I also
for
think the
sure.
problem right now is, and I feel like I'm actually in this beauty group chat with Allie Budd and 5 other girls.
Yeah.
And I think a lot of people right now are in this mindset of like, more is more. And it's like, okay, I've got a double cleanse. I've got vitamin C. I've got hyaluronic. I've got my retinol. I've got my 100 serums that I have to combine.
Yeah. And the thing is that everybody's skin is different.
Yeah.
So what we do is we will tailor a regimen to you, what you already are using, and
Right.
what else we can add to it, what your concerns are. If you have pigment issues, then we will add 1 or 2 products to help with that.
Right.
And not get overwhelmed. The problem is I find it overwhelming too.
Right.
And I've spent a lot of time learning about all the different products, and I'm just very choosy as to what I will use and when. And we don't have to get bogged down with 10 different products in the morning and night. It just doesn't make any sense.
Do you think it also makes like, how much of it is actually marketing and how
Yep.
much of it do you actually think like we were even just talking on this beauty thing and I was like, okay, guys, what's the best eye cream? And half the group was like, eye cream is honestly bullshit. And I'm like, is it bullshit?
I think it's hydrating.
Right.
And it depends.
But it's not going to help dark circles,
No.
puffiness.
No, some of them do help a little bit with puffiness.
But if you've got
they have-
blue circles under your
I
eyes,
don't find that it makes a big difference.
right.
So people will ask me, okay, well, under eye filler can help with darkness. It's sort of a byproduct of it.
Right.
It's not specifically for darkness, but it really does help it too.
Right.
And then I get asked all the time, is there a cream that's going to help me? Can we get rid of my darkness? I'm like, I mean, the reality is it'll be helpful for hydration, but I
No.
really don't believe that it helps darkness.
Right. So I actually have some questions about cost because someone was asking me this. She was like, I went to get Botox recently and she's like, this was the price. And I find obviously with the laser treatments, that's different because it's like, you get a package or this is the price. Whereas I find when you're going in for Botox or filler, I obviously trust you. I know you're not going to, gouge me, but there are other places when they're just like, oh, I gave you vial or it's like medical speak. And then they're like, and it's $1,000. And you're just like, is
after the fact.
After the fact. Okay.
I've been hearing this.
So can you tell us if someone is going to a cosmetic doctor, they're getting Botox or filler, what is the expectation with price and how do they ask about price so they don't feel like they're being duped or taken advantage of?
It's a horrible thing to feel. So I could just tell you what I do first.
Yeah.
I will never surprise somebody with a price after.
Right.
I will always discuss in advance.
Yeah.
Okay, well, this is what I'd recommend.
Yes.
This is the price.
You do that with me. Yep.
Yeah. You have every right to know how much a treatment will cost you. And if you're comfortable with that, everyone has a budget of different levels.
Yeah.
So we have to tailor it to what you're comfortable with.
Right. So if you're like, okay, this is the treatment plan. I think it's going to be $800 and someone could say, you know what, I'm actually more comfortable spending $200 or $300. And you're like, great, this is what we can do.
So you have to know, we'll only be able to address part of what you want, or really just target what you want.
Okay. So talk about budgets and costs before you actually start your treatment.
And I've had patients who come in and they say, thank you so much for telling me the price before. I'm like, what do you mean?
Yeah.
And then I get told, oh, I just got the bill afterward. It was this amount. I couldn't believe it. I didn't even feel like I got anything done.
Yeah.
And I felt so, I wouldn't want to be in that position either.
Yeah.
I want transparency for myself as well as my patients.
Yeah.
So you have every right to ask the cost of a treatment before you go ahead with it.
Yeah. Okay. I did actually have a couple more questions.
Okay.
One is hyperhidrosis.
Okay.
If you are a big sweater, I mean, I am a huge sweater. I literally sweat in the winter when I'm wearing a t-shirt.
I am also a ridiculous sweater.
You're a big sweater.
Yes, absolutely.
Okay. So Ryan and I both want to know, maybe we go in on it together, Rye Guy. We do a 2-for-1, is what is the deal with Botox in your armpits? It feels wrong stopping your sweat glands from doing their thing. But I spoke to another friend who's a doctor and she was like, absolutely not. It is not. And it's totally fine to do. So tell us your thoughts on that.
I think it's one of the most amazing treatments. It's life-changing.
Oh,
it's amazing.
There you go.
It's fantastic.
Life-changing. And you typically do it just in the armpits.
Just in the armpits. Yeah.
Okay.
That's
and
the most commonplace.
3 to 4 months.
Some people it's 3 to 4 months. Some people last them a year. Some people last them 2 years. Sometimes people will never sweat again.
So you literally stop
3 to 4 months.
Your sweat glands from producing sweat.
Correct. In that area. So there's been the question of, but does that mean the sweat's going to go elsewhere? You're going to overcompensate elsewhere. I don't find that happens.
No,
you just stop the sweat glands from working in that area and that's it. And that's where you sweat more often.
Oh, well, and I remember I used to have a job where I would have to present in front of like hundreds of people. And I was in my 20s and honestly, I could have really used that treatment. I would have to wear black. Like I would just like, and I swear I sweat so much you could even see it. It was like so powerful that it was like.
And the more you sweat, the more nerves you get about it. So the more you sweat after that because
of
that.
Totally. Yeah. Okay. Yeah. So you recommend it. You do it. It's a great treatment.
All the time. Yes. Okay. So if somebody has a drug plan, like a medical benefit, the Botox cost can be covered by their plan.
Okay.
And there's a fee for us to do the actual treatment.
Right.
But the Botox cost is often covered by their plan.
Oh, and is there are there any other treatments that are covered by OHIP or no?
So it's not OHIP covered.
Okay.
Yeah. So
not OHIP.
No, that's okay.
Covered through health benefits.
That is one of the most common ones.
Right. I've heard actually also Botox can help with migraines.
Yeah. So there's
you find that as well?
Yes, for sure. Yes, it can.
Yeah.
Definitely. We don't do the migraine protocol per se, so we don't really treat patients for migraines.
They would go somewhere else.
Neurologist.
Okay.
But there's another one that I'll tell you over the last few years I have been seeing a ton of. Okay. So it's Botox for TMJ or the masseters.
Yeah.
For clenching, for grinding. And that is also life-changing for patients.
Okay, well, this has been a really interesting conversation. I feel like I've learned, I thought I knew everything, but I didn't. Ryan and I are coming in for our hyperhidrosis session.
Even the under eyes, I would consider. So I've had bad under eyes my entire life. Just always dark.
There you go.
Yeah, and men's skin's very forgiving with filler treatments, and with Botox, it's wonderful. Like they look amazing when they leave.
Of course they do.
And nobody will notice.
Why would it be any different?
Of course. Once again, double standard, not fair. Just kidding. Yeah, my male patients are like, you can just do some really cool transformations, and they just look.
I feel like you should get more men on your Instagram. A lot of your before and after pictures are women.
I actually have there was this patient I treated a little while back. I literally transformed his whole jawline. He didn't approve me to use his whole before and after picture, but he did say that I could use his before and after of his under eyes specifically. Okay. He came back in to see me about a month later, and I was like,
you couldn't believe what he looked like.
You look really great. I was like, oh my gosh, you look amazing.
You're like, damn, that's my work.
Yeah. I was like, you look great.
You're like, I did good.
With his girlfriend. I was like, I'm thinking like, there's no way she for sure thinks he looks amazing.
Right.
Like, oh my gosh, this is awesome.
But that's the best feeling, so right? Where you do it in a way that it's like people are happy. They feel good about themselves. That is the goal in the most natural way possible, right?
And he didn't even realize how good he could look.
Right.
That was so cool.
Ugh, that's amazing. Yeah. Okay. Well, Dr. Andrea Herschorn, thank you so much for being on the podcast. We really love you. We're booking our appointments next week. We got a little work to do.
Yeah, a lot of work to do.
Yeah. I'll see you there.
Okay. Bye. Thank you.